Good afternoon to all of our participants. This is Sting Odi speaking on behalf of the UP Med Class 1994 webinar team. The UP Med webinar series is an initiative of the University of the Philippines Medical Alumni Society. It is held every Wednesday from 12 noon to 1 p.m. Manila time. It delves on important current and emerging medical topics and is targeted for physicians, especially general practitioners, occupational and industrial health doctors, primary care physicians, family and community medicine physicians, and other health workers. Registration is free. This webinar runs on the UP Manila live streaming platform at livestream.upm.edu.ph. If you have difficulties in accessing the webinar through the live stream page, please watch the FB Live video on our Facebook page. This session will run for an hour with 30 to 45 minutes allotted for lecture, followed by a question and answer portion which will be moderated by me. To participate in the webinar, please use the Q&A box found on the live stream page. For Facebook Live participants, please type your questions in the comments box. Please only use the comment section for questions and other webinar concerns. An evaluation link will be emailed to you after the webinar. Please answer it to get a copy of your certificate. Again, I am Dr. Ting Odi. I'm an associate professor of the UP-PGH Department of Anesthesiology, and I'm a proud member of the celebrating class UPCM 1994. Our time now in Manila is 12:01, and I'm speaking from the video conferencing room of the UP Manila IMS, Padre Faura Street, Ermita, Manila. Welcome to all participants. Today's webinar is entitled Mental Health in the Community. The objectives of today's webinar are: 1, to describe the global and local burden of mental illness; 2, to discuss strategies for addressing mental health issues, including prevention and early detection of psychiatric diseases; 3, to discuss ways to maintain mental health; 4, to analyze challenges to addressing mental health issues and opportunities for addressing these challenges from a public health and individual clinician's perspective. Our original speaker, Dr. Marissa Pascual, could not make it today, but instead we have an equally excellent speaker. Our speaker today, Dr. Carlo Paulo Silva Castro, is a graduate of the UP College of Medicine class of 2004. He subsequently did his residency training at the UP-PGH Department of Psychiatry and Behavioral Medicine, where he also served as the chief resident, and further subspecialty fellowship training as a clinical fellow in Consultation-Liaison Psychiatry at the Tan Tock Seng Hospital in Singapore. He has done a lot of work as a volunteer psychiatrist for the Council for Health and Development, or CHD, in some of their community work with victims of disasters. Currently, he's a clinical associate professor at the UP-PGH Department of Psychiatry and Behavioral Medicine. May we now call on Dr. Castro.
Thank you very much, Ting, for the introduction, and good afternoon to all the participants of this webinar. Okay. So the discussion for this afternoon, I actually changed the title when I was looking at the objectives presented to me by the organizers of this webinar. I felt that community mental health may not capture the discussion for this afternoon. Hence, I changed the title into Mental Health 2019 Challenges and Solutions. Okay. However, we will also speak about community mental health in the discussion of the current state of mental health. So before I start my lecture, some disclosure, I am a member of the 1MD program for Medical and Pharmaceutical. So this is the neuropsychiatry division of its parent company, Unilab. So I provide lectures for them. I receive compensations for my participation in their community advocacy program, such as their Lusog Isip program. Okay. So the sources for this afternoon's discussion are WHO Global Health Reports. So I was able to get some reports for us to see what is the current state of mental health in 2019, the global state of mental health, and also some local data. I also went into the CDC website I also got journal reports from JAMA and also from Lancet Psychiatry and articles from scientific publications such as Science Today and Psychology Today. These were generally generously sourced to me by my friends, Dr. Eugene Lau and Dr. Catherine Camus. So I thank them for sourcing out the publications for me. I also took inspirations from the TED Talks, which talks about their speeches, their talks about mental health. So TED Talks is a good resource if you want to look at viewpoints, which are out of the box. Okay. So the objectives for this afternoon is actually first to describe the global and local burden of mental illness, and then discuss the strategies for addressing these mental health issues, which we are facing this at this time. We also want to analyze the challenges and in addressing mental health issues and discuss practical ways to maintain mental health. So as I was looking at the objectives, I saw that somehow this would be discussed if we look at the challenges and also the solutions that we are currently facing in mental health. So the challenges that we are facing right now. So in the last 5 years or so, there has been a rising prevalence of mental health issues, which has somehow spurred interest in discussing mental health. Maybe in the 80s and the 90s, people were more concerned about hypertension, diabetes, circulatory infectious problems. However, we have seen a rise in the prevalence of mental illness in the last couple of years, so that the interest, this has already spurred some interest in talking about mental illness. So is it really a pressing problem right now? Okay? Do we really have to talk about it? Or can we just go about our lives, as we have done before, sweep it under the rug and not talk about it? So what is the burden, the global burden of mental illness in the community, in the world today? So if you're going to look at the WHO report in 2010, they have estimated that the deaths for neuropsychiatric disorders, for mental health and behavioral disorders, is 7.4%. DALYs would mean the disability adjusted life years. So this will be this is a public health concept which measures the burden of illness in the community. So for DALYs, those suffering from cardiovascular diseases, they suffer greatest. The DALYs would be around 11.8% for them. And the second would be those who have infectious diseases. And mental health would rank third among those, with 7.4% among the DALYs suffered by the world today. So we can see that there is really a great impact of suffering from mental illness and the quality of life of how we live right now. Okay. However, if we're going to look at, there are some journal or publications which actually challenge on how they computed the DALYs. They said that actually the DALYs that the WHO reported is an underestimate of the real DALYs that mental health sufferers suffer from. Okay? So they said that if you will take into account the disability, the personality disorders, which was not included in the computation of DALYs before, if you somehow aggregate the impact of suffering from depression due to other comorbid illnesses, they said that the DALYs would increase. The real DALYs would be around 13%. So what does this mean? If you're going to look at the slide earlier, this is actually, this will put the impact of mental illness the same as the impact, the gravity, the suffering that cardiovascular disease and infectious disease brings to those who suffer from it. So we see that with mental illness, the quality of life really decreases for a lot of people. If we're going to look at the distribution of DALYs among the mental illness, what are the most common diagnoses that we see? We see that the world today suffers from major depressive disorders. This brings about 2.54% of daddies, followed by anxiety disorders, drug use disorders, alcohol use disorders, and schizophrenia. If we're going to look at the top 10 diagnosis, we see that a lot of the diagnosis would concern mood disorders. Okay? And so this is one of the major problems that we are facing right now, and also substance use and psychotic disorders. So this is in the global state. If we're going to look at the WHO report of the distribution of depression around the world, we see that a lot of the depressive people, 85.67 million people, are actually from Southeast Asian region, which includes the Philippines. And what does our local data say about the distribution of illnesses in our country? Sad to say, we don't have really much data, local data, not much research is being done in our country. But in the institution which I was formerly affiliated with, the Philippine Mental Health Association in 2018, now we see a lot of patients who are suffering from schizophrenia, bipolar disorder, depression, generalized anxiety disorder, and ADHD. This somehow also reflects the diagnosis that we see around the world. Mood disorder, depression, and anxiety is very common also in the Filipino society, in the Filipino community right now. And most patients, we see this, the psychotic patients, they are usually the first patients to go to the psychiatrist because usually they would be violent, and this would be the threshold of consulting mental health professionals. Okay. We are also seeing a lot of challenges in our adolescents right now. In our current state, there are a lot of adolescents who suffer from non-suicidal self-injurious behavior. In the study done in the UK by the National Health Service, Central and Northwest London, they see that 6.9% self-harms. So non-suicidal self-injurious behavior would actually be those who cut themselves, with blades, not actually wanting to kill themselves, but our adolescents would usually do this to somehow express their discontent, because they would have difficulty in expressing their emotions. So they somehow involve themselves in these kinds of behaviors. So there's also a rising trend in these kinds of behaviors. In the US, there's about 6 to 8% of adolescents who have chronic and or concurrent NSSI. In the Philippines today, we do not have any current data for our adolescents, but in our clinics, in the psychiatry clinic, I work with the Department of Psychiatry in PGH. I see a lot of our college students, those also in postgraduate courses, who are involved in these kinds of behavior. That somehow when me and my psychiatrist friends talk about it, we tend to question if this is actually the norm today. Okay? Because so many adolescents are already involved in this kind of behavior. So we are already questioning, is this really a pathology or is this something else? Is this really normal behavior already for adolescents right now? And then we also have children. The children right now, most of the problems that we are facing right now with the children is in the diagnosis of ADHD. The data that I am presenting to you is the 20-year trend in the diagnosis of ADHD in the US. They have seen that in the early 90s, children suffering from ADHD had prevalence of about 1 in 20 children. However, as the years progresses, we have already seen a rise in the diagnosis of ADHD. So right now, they say that 1 in 9 children would suffer from ADHD. Is this the same also in the Philippine setting? In the child psychiatry section, there's also an increase in the trends in the diagnosis of ADHD. So what are the factors that we consider. So why is there a lot of ADHD diagnosis right now? They say that actually there are a lot of the diagnosis of ADHD right now may be due to the awareness of the people. In the early 80s and 90s, ADHD has not been that much talked about, but in the 2000s, there were a lot of awareness programs which and social media talk about ADHD, which help in the screening and the diagnosis of ADHD. In the US, pharmaceutical companies making medications for ADHD has been very, very active in lobbying for the screening of children for ADHD. This has also somehow increased the diagnosis of ADHD in the US. They're also saying that technology has also played a part in the increase in the diagnosis of ADHD. In the sense that preterm infants and those who are low birth weight infants, they are, because of the increase in the efficiency and in the medical technology, they survive. And low birth weight and preterm delivery are factors that may contribute to a diagnosis or development of ADHD. Okay. So those are the common diagnoses. So in the adults, we have depression, anxiety, and also in the Philippines, there's a lot of psychotics, schizophrenia diagnosis. In the adolescents, we have non-suicidal self-injurious behavior. And in children, we have a lot of ADHD going on right now. And also, part of the challenges that we are facing right now, aside from diagnosis, is the accessibility and availability of mental health resources in the Philippines. If you're going to look at the resources available for us, we see that as is with other health conditions, mental health is still sourced, financed out of pocket of the consumers. Okay, so we don't have any insurance system which would cover actually for your mental health consults. If you get admitted in the patients, we have very limited resources outside from the earnings of the family to finance that admission. So the main source of funds for care of severe mental disorders is still through the household. We also see that there is a dearth of human resource for mental health. The total reported staff for mental health for inpatient care is around 1,355. So in the Philippines today, there are only about 500 certified psychiatrists. So the population of the Philippines right now is 100 million. So we have 100 million Filipinos living in the Philippines. And they say that mental illness, the morbidity of mental illness for any given population is around 1%. So if you're going to compute that, we have actually 1 million people, 1 million patients suffering from one mental illness, from a form of mental illness. And we only have 500 psychiatrists. And if you're going to add psychiatric nurses, social workers, and also other mental health professionals, they estimate that there would be around 2,000 mental health practitioners in the Philippines. So if you're going to compute, there would be around 2 mental health practitioners per 50,000 Filipinos suffering from mental illness. So you can just imagine how many people who are suffering from mental illness and they do not have access to mental health care. So these are some of the challenges that we are facing right now as a nation and as a global community. So we have a lot of depression, anxiety. We have a lot of adolescents cutting themselves and expressing their discontent and depression. And we have children who have ADHD. So we kind of look at the world right now. The picture is kind of bleak. It's a sad and anxious world with a lot of teenagers hurting themselves and with a lot of children having hyperactivity symptoms. So how are we supposed to address these problems? So the solutions. the solution actually that I thought of would be still to approach these problems with the community mental health perspective. We should start taking care of the community in order for us to address this global and local public health, mental health concerns. So right now in the Philippines, what are the steps that we are undertaking to address these problems? So the community resources right now, in the community in the Philippines right now, we have the mental health law, which was recently passed last year. Actually, we are one of the last nations to have a mental health law passed. But I think this is a step in the right direction. I have been working in the community for a long periods of time. I worked in Leyte and Samar right after, in the context of disaster. I worked there after Typhoon Haiyan, Yolanda, and I saw how it was so difficult to put in mental health programs in the community, especially since during that time, that was around 2014 and 2015, there was still no mental health law. So that in the community, it was very hard to put in mental health programs because you really have to lobby with the mayors, with the municipal health officers, and to make them realize how important mental health is for their community. With the institution, with the approval of the mental health law, this will aim to integrate mental health services in the primary care level. So you have a law, we have something for the community workers, we have something to cite to the mayors, to the local government unit, for them to move into making and to creating mental health programs for their community. The mental health law aims to integrate mental health services in the primary care level so that in the communities they are required to create programs for mental health, and then they're also required to hire mental health professionals in the community, at least one in the local government unit. Also, the mental health law aims to promote mental health activities, not just in the community setting, outside the homes, but also in the school setting. I think this is a very important part of the mental health law, that mental health should be integrated also in our educational system, so that schools will be required to talk about mental health when they talk about general health. Okay? I think this is also one of the ways in which we can somehow address the problem of stigmatization. If we talk about mental health in the educational setting, that may somehow desensitize people and give the message, children, and give the message that it's okay to talk about your mental health. So these are some of the points that mental health law are espousing, okay, in order to address the problems of mental health in the community setting. So aside from the mental health law, what can we do with ourselves, by ourselves, in order to address the problems of depression, anxiety, the discontent in the adolescents and ADHD? Actually, we have to take care of ourselves so that we don't need to consult anymore for treatment for psychiatric disorders. So I still say that promoting mental health will still be the way to go. Preventing morbidity for psychiatric disorders is still the way to go for us to address these problems. So what should we do in our personal level to avoid and mitigate the morbidity in mental illnesses? So first, actually, is to have a healthier eating habits. Okay, so a study done comparing the Japanese and the Mediterranean diet with Western diet. This was the study done in the U.S. So they looked at how diet affects our mood, and they saw that when you when you eat the Mediterranean or Japanese diet, your chances of developing depression decreases by around 20 to 25% compared to when you eat Western food. So they say that a diet rich in fruits, in vegetables, in legumes, diet rich in fish, and then compared to diet which are composed of processed foods and refined sugars, they saw that the more organic your diet is, the lesser your chances, the lesser your risk for developing depression. Also, right now, there is a move for you to, they have already seen the benefits of eating food rich in probiotics. So these are fermented foods. So examples of fermented foods would be kimchi, the miso, and the pickles that we have, maybe in the Filipino setting, the puro, the achara. They have seen that when you eat fermented foods, this also affects our mood. Okay? So how does fermented food probiotics affect our mood? If you eat probiotics, it makes digestion more efficient. And when you digest foods more efficiently, you have better raw materials for your neurotransmitters, which are also very important in the regulation of your mood. So that there is actually an adage to the saying that you are what you eat. So if you eat healthier, we feel and our physical body also becomes healthier. So this is one of the things that we can do, a healthier diet. We are also espousing that you eat more vegetables and fruits and then lessen your intake of meat. This will also somehow be friendlier to nature, since in one of the studies, they saw that if you eat more vegetables and more fruits, you have lesser carbon footprint in the world as compared to if you eat a lot of meat. They say that raising cattle, the carbon footprint that produces almost equals all the carbon dioxide byproducts of transportation, cars, airplanes, boats, mining. So they say that eat lesser meat so that you have lesser carbon footprint and eat more vegetables and more fruits. This will make you a lot healthier. This will also decrease your weight. So eat more fruits and vegetables. And among the meats, they say that fish, the fish and pork, fish and beef would be more preferable because these are the meats which produce less inflammation in the body as compared to pork and chicken. Inflammation has already been implicated in the development also of mood disorders. There are some school of thought that they say that depression is actually one of the causes of depression is inflammation in your body. So if you're going to choose meat, choose fish and choose beef over pork and chicken. Okay. Another thing that you can simply do, taking care of your mental health, would be to have more physical activities and exercises. The recommended number of hours that you should involve yourself in physical activity would be 2 to 6 hours of exercise per week. Okay? So that would be around 45 minutes. Now, if you go to the gym and spend time there around 45 minutes each session to a maximum of 2 hours per session. Now, they say that they put the ceiling on the 6 hours because they have found out that people who spend more than 6 hours of their time in the gym, this is in excess, and they might be suffering from another form of mental illness. So they say that you just exercise between 2 to 6 hours a week. So what kind of exercises should you do? You can do resistance exercises. Resistance exercises have been found to produce more endorphins and enkephalines in our body. So resistance exercise would be weightlifting. So we have a picture of Heidelin Diaz there doing weightlifting, but you don't really have to do that much weight. You can also start with a 5 to 10 pound dumbbell. Do resistance training and then do aerobics exercises. They say that if you do it in groups, if you involve yourself in team sports, that would be a lot better. That would curb your chances of developing depression, in the sense that you are also involving yourself, interacting with other people. Interaction with other people, healthy interaction with other people, having very good social support has been found to decrease your risk for developing depression. They have also found out that meditation in the form of Tai Chi, in the form of yoga, are also very much beneficial for your mental health, in calming your mind, in calming your nerves. So do eat a lot of healthy food and do also physical exercise or physical activities. What is most underestimated, I think, among the non-pharmacological interventions that we should do would be nurturing warm and good relationships. It's very important for you to have very good relationships. Relationships are what would help us overcome the stresses that we face in the world today. Remember that the world today it's a very stressful place. The stresses can only be controlled up to a certain extent. So what we should do would be change ourselves or provide ourselves with a lot of social support in order to overcome the stresses of this world. So what we're saying right now is nurture warm and good relationships. Having very good relationships will increase your social support, will help you address problems more efficiently when you have other people helping you out. And this has also been proven in terms of the molecular level. Okay? When we are under stress, our bodies actually secrete the hormone oxytocin. If you remember, oxytocin in OB would be very important in the contraction. After giving birth, the oxytocin is produced by the brain in order for the uterus to actually contract so that you don't die of bleeding. However, oxytocin is very also important after birth because that is during the time that the infant latches to the mother, and it actually is the bonding hormone for the mother and the child. So much so that we have also seen in stress psychology that when we are under stress, our brain actually secretes oxytocin. So this is interpreted as our brain signaling for us to seek social support in order for us to actually survive the stresses that we have. So nurture warm and very good relationships. So how do we do that? You can combine it with the other two strategies that we have discussed earlier. Go out with your friends, eat with your friends, exercise with your friends, bond with your friends. Take time to talk to your friends. In our society today, we have technology is very, very much part of our world right now. And sometimes we are very much busy looking at social media and we forget to bond with our friends through actual talking and spending time with them. So as a psychiatrist, I encourage everyone to actually be talking to your friends and spending time with their families and taking care of your neighbors. And in doing all of these, we're actually we're decreasing our chances in suffering from morbidity, okay? Psychiatric morbidity. So to summarize everything that we have discussed this afternoon, we have described the global and local burden of mental illness. So we have seen that the world today, among all the illnesses that we have right now, psychiatric morbidity accounts for a lot of the dialysis being suffered right now, and this is a very pressing public health concern. We have also discussed some strategies of addressing these mental health issues. It's a very complicated problem, but we should all start with taking care of ourselves, with taking care of our family, friends, neighbors, in order for us to avoid morbidity in order for us to avoid suffering from mental illness. We have also discussed practical ways to maintain mental health. We have seen how much our diet, how much our exercise, physical activity, and how much our social relationships play a role in our adaptation in the stresses in the world right now. So with that, thank you very much for listening for the lecture, and maybe we can proceed if there are some questions for the webinar this afternoon.
Thank you for that insightful lecture, Dr. Castro. We now have 154 logged in through live streaming and 188 participants through Facebook Live. We'd like to thank today's sponsor, Johnson & Johnson. And now we will allow our webinar viewers to ask questions from our speaker. Okay. So would you say that the data that you presented earlier regarding prevalence of disease entities in the US, does that directly reflect in your clinical experience? You said that we don't have data.
Yes.
But does it reflect? Does it reflect?
So I think that if you look at the US data right now, there's a lot of depression and also anxiety. This reflects also the global burden of illness. There really a lot of depression and anxiety right now. In the Philippines setting, I think it varies as you go up the socioeconomic ladder. So for patients who are coming from the C and D socioeconomic group, a lot of people would be suffering from those who go to the clinic would suffer from psychotic illnesses. So we see a lot of schizophrenia in those cases. However, we do not say that this is the most prevalent in those socioeconomic group. Maybe these are the people who would go to the psychiatrist because they are violent. The depressive people would not have access, even if they belong to the C and D. You might have a lot of depressive people, but because of the lack of awareness and the lack of accessibility to mental health, they may not be able to reach the psychiatrist. In my clinics, where I see B and C, AB socioeconomic groups, I see a lot of depression and actually anxiety. Okay, which is also reflective of the global burden of illness. So right now, we see that depression, anxiety, and psychotic illness, schizophrenia, are very common in our community.
So you'd say that it's the same all over the world. The distribution is more or less the same.
The distribution, the trends is almost the same. It just varies a little on the rank. Okay, you're going to see psychotic illnesses as first, or depressive or anxiety illnesses as second and third. But we see that if you look at the top 5 diagnoses, we have the same trends all over the world. It's still depression, mood disorders, anxiety disorders, and a lot of psychotic illnesses, schizophrenia.
You mentioned earlier that a major burden, that the burden of mental illness is actually placed more on the family rather than on any other responsible party. Are there actually is there an environment where another party is responsible for maintaining community mental health? Like for instance, what I'm asking is there government support in other countries that would allow better healthcare at the community level to be given, mental health care to be given?
Yes. Right now we have the mental health law. Actually, the mental health law places responsibility in government institutions to take care of the mental health in the community. So and funding is very important. So the mental health law would mandate the LGUs to actually give sufficient funding for mental health programs. Right now, also they have already started the medicine access program for mental health, so that the government provides, although it is a limited provision, the government provides medications, especially for those suffering from mental health disorders. So there are some budget right now that the government is trying to appropriate for and support for mental health programs in the community. However, if you look at the insurance system right now, PhilHealth only covers a certain certain diagnosis, inpatient diagnosis for mental health problems. We don't have any support from PhilHealth in terms of outpatient consults, and this is the one of the things that municipal health officers, the doctors in the community, are clamoring for. Maybe the PhilHealth can somehow also give support for those who are suffering from mental health illness in the forms of funding for the medications and their consults.
What do you mean? But like what diseases are isolated by PhilHealth for inpatient?
I think for inpatients, those who are suffering from, those who have suicide attempts, and those who are admitted also for some violent behavior, a certain number of days is being covered by PhilHealth. In terms of the
Outpatient, there's absolutely none.
There's absolutely none. I don't think also in other illnesses, PhilHealth covers for outpatient consults, but for psychiatry, there is no support from PhilHealth in terms of outpatient consults and medications.
But this will change with the mental health law.
The PhilHealth, I'm not really sure if they will be able to implement that provision. The implementing rules and regulations, the IRR, is still being written right now. But in terms of the financial support, it will be really coming from the local government units, the LGUs. That's what they are advocating for.
You have several questions, Dr. Castro. How much is the predisposition towards the use of electronic devices? How much does the predisposition towards the use of electronic devices affect the non-suicidal harm that adolescents inflict on themselves?
So, to paraphrase that question, is he asking if there's the effect of social media,
the effect of electronic devices on the
NSSI behavior? I think this is more common right now because of the information overload that our adolescents are exposed to. Some of the information you don't really need to know, but they are exposed to those information. For example, they see in social media that their counterparts are partying. They seem to have a lot of what is being portrayed in social media would only be the positive things that they are going through. So our adolescents right now would think that other people are happy, contented, would have all the things that they want at their disposal. And this would somehow make them feel worse about their current situation and may somehow contribute to self-pity, self-destructive behavior, and they would contribute to some non-suicidal, self-injurious behavior. So in that sense, in some of the adolescents, it's not really, they have to be very critical about the information that they get from the internet, from the information that they get from their electronic devices, because this would really play a role, and also how you would feel, especially on the days when you are vulnerable to such suggestions. So I think the message here is to be more critical of the information that we expose our adolescents to.
From the practical standpoint, I think maybe the practical question that parents would be asking would be: would there be any value in limiting what our children see? Will there be any value in limiting the amount of exposure they have to social media?
Yes, that's a very good question, and I think that's one of the most common concern of parents. No? How much TV time, internet time, how much social media should you give your children? There's really no hard and fast rule. The American Pediatric Association would say that for children 0 to 2 years old, you just expose them to video conferencing and do not let them watch television. For children from 3 to 8 years old, they say that you only give them 1 hour of quality TV time. TV time and exposure to social media. Actually, they say just TV time. And then for 8 years old and above, they leave it up to the parents to decide how much social media they're going to expose their children to, taking into account that the children should be able to sleep at least 8 hours, 8 to 12 hours per day, and then they should be able to do the things that normal children should do. They should involve in play and not just in internet or virtual reality play, but actual play with other children. If you're going to look at one branch of one form of medicine, which is anthroposophic medicine, they actually say that in that form of medicine, they do not expose children below 12, 13 years old to technology, to social media, because they say that somehow exposing our children to artificial technology also has an effect on the creativity of children. They say that for children, they should go out and play in nature. They should go out and play with other children, and this has the appreciation of nature and that natural setting would somehow stimulate more creativity in them, as opposed to just exposing them to technology. Okay.
I read something written by sociologists that hypothesized that one of the biggest problems that this technology brings to our children these days is that they are being taught to obtain their affirmation from outside, from social media, as opposed to having previously been satisfied with affirmation from within the household or within the I guess this ties in with what you mentioned earlier, the nurturing of good relationships, which actually that sociologist said was the basic solution to this dearth of problems that we're having with the kids now who are addicted to social media.
We can see that kids may be addicted to the social media, but also the parents, the behavior of the parents also shapes the behavior of the kids. So that if the children see that their parents are too involved in using their phones and using their internet, they mimic also these kinds of behavior. And also if parents are the time that parents would spend social media would take away time, quality time that the parents would spend with children. So you can see the dynamics of how technology affects the family and the interaction of the family. And it's very true. Whereas before, parents would play a critical role in affirmation, in the formation of the self-esteem of children. Right now, social media affects that formation of the self-esteem, so that they would look out affirmation in social media, not anymore with the parents. So that's very alarming, the dynamics that we have to address right now.
It's fascinating because our generation, when we post something, we don't really care who reacts. Right? I post something not caring whether people will like it or not.
Yes.
While this current generation, live for the likes.
Yes.
And I think, would you say that this actually, can you link narcissism to this? Are they being led towards narcissism? Can narcissism be developed from this type of behavior?
Narcissism can definitely be espoused, encouraged more. The unhealthy narcissism. Remember that all of us would undergo there's a normal narcissism in everyone in the development of children, but we should not be stuck in that stage of narcissism. If you are affirmed well by your parents, you go through the normal narcissism and not become narcissist in your adulthood. But then if you do not get the affirmation that you need, then you carry this over in your adulthood. So that when you see that narcissists in adulthood will actually manifest as you wanting affirmation from other people. You always want to get the awards, you always want to be the center of attention, because that is the affirmation that you need. The dynamics of narcissism actually is very low self-esteem. Beneath the the seemingly high regard that they have for themselves, beneath that is actually a very low self-esteem. Okay, so affirmation from the parents is very important for us to go through narcissism, yeah, and not be stuck in that stage.
Thank you. We have other questions. What do you do if the patient refuses to continue wellness sessions?
Okay. I guess this would be coming from mental health professional. I think really you have to talk to the patient and know the reason why he was refusing or not wanting to continue with wellness sessions. I do not. I'm not sure what this wellness session mean in that question, but then know the reason why and try to address those concerns of the patient. Yeah.
Depression appears to be a common word for young people today, as in everyone is entitled to be depressed and sometimes becomes their way of getting attention. How can we go about addressing depression among teenagers and the young population?
Okay, so depression is very common, not only in the young, but also in the adult population. So I guess one of the things that you can do is actually talk to the teenagers, and see why are they depressed. Remember that depression is a normal emotion. We all get depressed sometimes, but clinical depression is a different thing. Clinical depression is really pathological. It is it impairs on our functioning. And when you suspect a teenager to become depressed, you try to talk to them and ask them why are they becoming depressed, and hopefully this conversation will somehow give you an idea on how to address that problem for that teenager.
Is there a call center for mental health, or a mental health hotline where people can be advised to get help from the government?
In terms of government mental health line, I think there are non-existent right now, but there are some NGOs which have helplines. I know that the Jeannie Goldborn Foundation, Hope Foundation also has a hotline. I don't know the number right now, but you can source it out on the internet.
What is it? The Jeannie Goldborn Foundation and the
Hope. I think it's a Hope line. That's the name of the.
This is something that you call if like you're feeling
if you're
suicidal,
feeling depressed, suicidal, yes. So there are some mental health volunteers who would answer your call and refer you to a mental health professional if you need one. And then there are also trained counselors in those hotlines. Yeah. But in terms of the government, I don't think there's any existing right now.
Immature. With this is another step that needs to be looked at with the development of the mental health law.
Yes.
What is your opinion on the use of medical marijuana in mitigating symptoms of mental disorders?
Medical marijuana right now is still very controversial because there are a lot of, we have to be very critical in its use. These are, in terms of psychiatry, we don't have actually evidences that they will somehow be very helpful for psychiatric disorders. Right now, medical marijuana, the indications are more for pain management. In some, they use it for anorexia, but in the Philippines, I don't think we are there. Yet. So
first of all, we do not legally recognize medical marijuana.
Yes, but there are some talks already right now to actually legalize it. But right now, my personal stand is that you have to be very critical about it in the use of medical marijuana.
Next question. When do you suspect mental health issues in adolescents and in the elderly?
When do you suspect? Well, in the elderly, mental health issues would be actually in everyone. If you have impairment of function, if you're not able to do what you're supposed to do, for example, if you're an elderly, if you're not able to take care of yourself, if you see that they are becoming more socially withdrawn, those are some of the red flags that they might be suffering from something or undergoing something. Okay? In adolescents, no, adolescents are supposed to be in school. They're supposed to be studying. They're supposed to be going out with their friends. When you see that teenagers are not anymore going to school, not able, they are failing their subjects in school, they are observed to be more socially withdrawn with their friends, then those are some of the red flags that they might need some help. Okay? Not necessarily psychiatric or mental health interventions, but you may need to somehow talk to them and ask them if they're undergoing through something. See the reason why for these changes in behavior.
Yeah, I like this question. It's finally going where I wanted to go. What is the role of the spiritual advisor in patients with depression? Is it sometimes contraindicated or should be delayed until after antidepressant medications?
Okay, so what is the role of spirituality? I think in depression, no? It actually depends on the person. It varies from person to person. I have a lot of patients who would not be comfortable in speaking about their own spirituality. They would rather have more non-secular kind of therapy, and they're turned off when you talk about spirituality. So for those kinds of patients, talking about spirituality, their beliefs may not be beneficial for them.
Mhm.
Okay. But in most of the patients, especially in Filipinos, spirituality is very important.
That's right.
Okay? And some studies have found that actually spirituality, having a belief system, having a philosophy, can be a protective factor from depression.
Mhm.
Okay? What you believe in, your philosophy in life is very important. Very important. I think it should be talked about in a particular sense of patients. Interestingly, in terms of suicide, they see that those who are Muslim, they have the least amount of prevalence of suicide
Really?
compared to those who are Catholics and other religions. So you can see also what the effect of spirituality and the philosophy and also our behavior.
What about antidepressant use? I think what she's asking is if somebody is depressed and wishes to seek spiritual advice, like go to the parish priest or something like that, should that be delayed until after antidepressants have been started, or can that be done simultaneously? Or
Okay. You can look at spiritual advice as a form of therapy, psychotherapy, and it has been proven that if you do combination psychotherapy plus medications, you have better outcome. So, in my opinion, you can do both at the same time. Do spiritual advice, do counseling, and then take medications.
Okay. We're about to wrap up. Thank you for that engaging discussion, Dr. Castro.
Thank you very much.
If you could summarize for us in 2 sentences.
The discussion for this afternoon. So we have learned that really the world is suffering from depression, anxiety, and self-injurious behavior, non-suicidal self-injurious behavior, and ADHD. It's a very complicated problem, but we can do something about it by taking care of our own mental health, by eating healthy, by exercising, by taking care of relationships, having very good social support in terms of family, friends, and neighbors. We can mitigate the effect of the mental illness in our daily lives.
Okay. After this session, the link to the evaluation form will be emailed to the email address you entered in the attendance form. Please answer it immediately to get a copy of your certificate a week after the webinar. Webinar recordings of our previous webinars are now available at the UP Manila official YouTube page. You may access the following webinars through the link flashed on your screen. http://www.youtube.com user UP Manila channel. Thank you for joining us. And we would also like to thank our sponsor, Johnson & Johnson, for their support to this webinar. Thank you again, Carlo.
Thank you, Dave.
We hope to see you again in our upcoming webinar on February 27, 2019, Wednesday, 12 noon to 1 p.m. Manila time with our speaker, Dr. Marcia Tolentino, entitled Putting Heart into Diabetes Management, Cardiovascular Risk Reduction in Type 2 Diabetes Mellitus, sponsored by MSD Philippines. We will be webcasting from Cebu City. Please invite your colleagues to join this continuing weekly CME webinar series. All webinar schedules and resources will be posted at http://facebook.com upmedwebinars. You may also email us at upmedwebinars2019@gmail.com for any inquiries. On behalf of UPCM Class 1994 and the UP Medical Alumni Society, we also thank our collaborator units, UP College of Medicine Postgraduate Institute of Medicine, the UP Manila Information Management Services, IMS, and AHIN. This is Dr. Ting Odi with Dr. Carlo Castro and the UP Medicine webinar team closing this session. We hope you have learned a lot from today's webinar. Join us again on February 27. Please also join the 2019 Aging and Longevity webinars every second and last Friday of the month.